I'm Lee, and today I'm going out to the Point Teen Clinic on Johns Island. I'm meeting my friend Catherine out there, and we're going to meet some of the staff, find out what services they offer, generally get a feel for the place, and report back to you about it. I hope you find our adventure exciting.
Right now we're at the Point, the clinic, and right now this is gonna make me happy.
I work with D at Region 7, and this is the teen clinic for Johns Island.
So I say this waiting room is pretty nice. I mean, they've got really comfy furniture, nice lots of like updated magazines, chalkboard, magnetic poetry on the door. I definitely feel comfortable, and they even have a pretty fancy looking television.
Well, Catherine's playing the lead. This is so fun.
I am a certified nurse midwife. I am sort of the teen clinic healthcare provider here at the Point on Johns Island and also at the Point Northwoods. We provide family planning services, which includes abstinence training as well as birth control methods, including condoms and oral contraceptives and pretty much every birth control method you could want with a few exceptions. We also do STD testing for males and females, and the treatments that we have are available for that as well.
What does it cost to come here? Is it free?
Yeah, well, we encourage people to sign up for the insurance program that we offer. It's it's a family planning waiver, which covers all the services that we provide. If you are a teen and you don't want to apply for that, you don't have to. And I believe I'm a little fuzzy on all the rules on the family planning waiver because I'm relatively new here. But if you're a teen and you need services, we will see you anyway at no cost.
Well, since I'm a teen, since I'm just 15, do you have to like bring a parent with you?
No, you do not.
And do I have to tell my parents?
No. We encourage you to talk to your parents. We encourage parental involvement, but it does not hinder me from giving you any services.
Do you offer any EC here, any emergency contraception? You do?
Absolutely, we do. And you have 5 days with your mishap to come in and get treatment.
So we can just come here and get the pill, and you don't have to go to a pharmacy or anything, or do you just get a prescription? Cool.
No, I have it here, and I can dispense it as needed.
Great.
Yeah.
Are there any age guidelines on that?
As far as the emergency contraception?
Mm-hmm.
Yeah. And this is our little lab. It's teeny, but it does the trick.
The room where the doctor and the patient, and this is where the patient sits, and this is where the doctor sits.
So what do you do during a typical exam if a girl came to see you?
A typical annual exam would include just listening to the heart and lungs, a pretty basic assessment of that. And then I would have her lay back and I would do a breast exam and just talk to her about doing her own self-breast exams and the way you should go about it and how often and so on. And then I just palpate her belly to make sure she doesn't have any tenderness or anything. And then we used to just move down into doing the pelvic exam, which is probably the most anxiety-driven part for most women. But what I do is I just look on the outside initially, make sure everything looks nice and normal, and then we move to the pelvic exam part where I'll insert the speculum and get a good peek at her cervix, and just look at the discharge if there is any. If she has any complaints, I'll take any testing. That's when I would do the chlamydia and gonorrhea test or the pap smear or the pap smear. And then we're pretty much done for the most part. It doesn't take all that long. I can assess her skin while I'm doing the other parts of the exam, so that's another aspect of the exam that doesn't necessarily get direct attention, but it is something that gets assessed. And then I just collect my specimens, and if I need to look at anything under the microscope, I do that. And then I send off any specimens that need to be sent.
How quickly would someone find out if maybe they did have a problem that needed to be addressed or they did have an STI? How quickly would they be able to know?
Because I'm only here 2 days a week, it might take about a week and a half to 2 weeks. I'm really big on providing information and talking to women about their bodies and providing pamphlets, things for them that they can take home and read and look at. And I try to make myself as available as possible. I have a DHEC cell phone that teens can either text me or call me on if they have any questions or any concerns. So that's really my big thing, is to empower women.
So all in all, I say the Point's a pretty great clinic. Again, if you want to schedule an appointment with them, you can call 953
or you can call 539-2855. There's also a website too. So yeah, they have a great waiting room, really friendly staff. I don't know why anyone would